here with us. I'm very appreciative of that, very appreciative. So for those of you who didn't hear my introduction at the beginning, Dr. Carol, she's also here in California, and she works with, she's a professor at Stanford University, and she works in the oncology department. Is that correct, Dr. Carol?
Yeah, in radiation oncology.
In radiation oncology. So she has vast experience in this topic, and hopefully if we have some people asking questions live, she will be able to respond some of them. So we'll see how this goes. So I don't know if you had a chance to listen to the full interview with Jose. It was very inspiring to hear his experience, and now we're looking forward to hear more about the scientific part of it. And I would like to start asking you about the development of cancer. I recently saw an article that was titled something like "Breast Cancer Awareness." This woman, cancer can catch you at the healthiest stage of your life, and it always sounds like it comes out of the blue when you never expect it, and you're feeling so great. So I guess it's a question that everybody has, and probably nobody has the response. But in an effort to try to understand, I wanted to start asking you about why and how does breast cancer develop?
So breast cancer isn't caused by a specific exposure like smoking or anything like that. It's really a result of genetic changes that cause the tumor to develop. So a woman, there's no clear association between diet. There is an association between alcohol. So averaging more than a drink per day will increase your risk of breast cancer. There's also an association between taking hormones after you've gone through menopause and having an increased risk of breast cancer. But most other things that you typically think of being would not increase your risk of breast cancer. So it really your biggest risk factors are being a woman and having breasts and aging. So breast cancer, while we hear about breast cancer in young women often, breast cancer really is the disease of older women.
It's interesting that you mentioned about the young women. I actually interviewed a young girl. She was 24, but she actually developed this cancer when she was 18, and it was surprising. She actually said, "I like sharing my story because I think it's important that people know that this is something that not only happened to women in their 40s." So it's very clear, like you're saying, you just need to be a woman and have breasts. Right. I would like to go back really quick and see if you can provide with a little bit more detail on the alcohol part. I love wine. So I'm like, okay, how much am I drinking?
Right. So have been retrospective studies looking at women, and it's fairly clear that those women, as I said, who average more than a drink per day, so 7 drinks a week, are at increased risk for breast cancer. It doesn't, and we don't really know is what if a certain type of alcohol puts you at greater risk. But there is some suggestion that wine, especially red wine, may be of benefit to your heart. So we don't tell women that they have to completely avoid alcohol, but if they can keep it to 3 or 4 drinks a week, that would be preferable. The other 2 things is about things a woman can do to decrease her risk of breast cancer is not gaining too much weight. So
really.
Yeah, so increased weight is definitely a risk factor for breast cancer, as is not exercising. So once a woman is diagnosed, we strongly encourage her to not gain weight and to exercise regularly.
Wow, that's very that's something very, it's kind of shocking for me because like I said, you see a lot of women out there saying I was super healthy and still they have it. But I guess that if you want to think about all the possibilities and try to be mindful about it and do whatever you can do, you have to take in consideration all of this IDS. So how do you doctors stage cancer? On my previous interview, I was actually trying to give a brief vision, because he was saying that his wife was diagnosed when she was stage 1, and I understand there is stages from 0 to 4, right?
Correct.
Okay, can you tell us a little bit more about that?
Yes. So staging is based on the size of the tumor, the presence of lymph nodes, whether or not there are involved with cancer, and then how many are involved, and then whether or not the cancer has spread. So if we start at stage 0, that is for disease that is not yet invasive or infiltrated into the fat of the breast, but that's disease that is still contained within the ducts of the breast. That's stage 0. Patients with those kinds of tumors where it's still within the duct, the cancer can't go to the lymph nodes and can't spread to the rest of the body. It's stage 0. On the other end is stage 4. That's disease that's already spread to other parts of the body. So between are stages 1, 2, and 3. Stage 1 is confined to the breast and doesn't have lymph nodes involved. Stage 2, the tumor may be bigger and may have small amount of lymph node involvement. And stage 3 typically has a large tumor and has lymph node involvement.
How fast do the cancer evolve? Do they have like a period of time to go from one stage to the other? And is it the same in every woman, or it's different?
No, it's completely different from case to case. So there are some women who will stay stage 0 for years. They could have had that stage 0 cancer for years. And then there are some women who rapidly progressed and presented stage 3, even though they had a normal mammogram last year, and then this year they come in and they have stage 3. That's just the nature of the cancer that they have. It may be very rapidly growing. So breast cancer has a huge range from very, very, very slowly growing tumors to very fast growing tumors.
Wow. It makes you scary, because you really feel like, okay, I just really need to be on top of it, I guess is the best takeaway I can get from that. So what are the chances of breast cancer coming back after it has been removed, or you have gone under chemo? And how do you determine that? Because I've heard cases where people say, the doctor told me it's going to come back in about 6 months, a year. How are you guys able to determine that?
So it's always it's not a perfect thing. We don't have, as they you've heard doctors say, we don't have a crystal ball, but it really depends on the cancer, because again, they grow at different rates, they come back at different rates. Some cancers, we can tell patients, this one has a really, really low chance of coming back because it's a slow growing tumor. It was small, the lymph nodes were negative, it was completely removed. We have many therapies that it's going to respond to, versus other tumors that are very fast growing. We don't have as many treatments for them. They may not respond as well to the treatments, and they may have already spread. Those patients are at much greater risk for having it come back and come back sooner.
I see. Having had breast cancer makes you more vulnerable to develop other type of cancers?
There are those people with a genetic predisposition to getting cancer, meaning they already have a genetic abnormality, something that puts them at greater risk for developing breast cancer. And certain of those genes also place them at risk for developing other types of cancers. If the patient doesn't have those genetic abnormalities, having breast cancer doesn't necessarily put them at risk for other types of cancers for the most part.
I see. So now you're
let me just clarify. I just want to clarify one thing. If the breast cancer spreads to another part of the body, like to a bone, that's still breast cancer. We still call that is still breast cancer. It still looks like breast cancer under the microscope. It still behaves like breast cancer, even though it has spread to the bone. So
how is that possible?
Well, that is the nature of cancer. Cancer is that's one of its hallmarks, is that it can spread and grow in other organs. And when you look at it, it doesn't look like the organ where it is, it looks like where it came from. So if it spreads to the liver, if it's breast cancer, it'll still look like breast cancer. It doesn't look like liver cancer. And so it's still called breast cancer. It's stage 4 because it's spread to the liver, but it's still breast cancer.
Okay, so let me ask you something about that. If someone has cancer and breast cancer in the liver, I guess my first question is the treatment for breast, and I'm going to talk about treatment next with you. So let's just dive in right now. What are the treatment options is the first question. And then the second question would be, do you treat the breast cancer in a different part of the body differently, or is it the same?
Again, so we have 4 main ways that we treat breast cancer. Surgery, radiation, chemotherapy, and hormone therapy. There is increasing use of also immunotherapy, which is very commonly used in other types of breast cancers, but is increasingly used now beginning to be used in breast cancer. So if something has spread, how we treat it depends on where it's spread, how big it is, how extensive the spread is, if there are other sites of spread, if it's going to respond to chemotherapy or if it's going to respond to hormone therapy. So it really depends. It's a very individualized case-by-case treatment plan.
I see. And what would be the difference between, the main difference between all of these treatment options?
Oh, okay. Yeah, so surgery is, we're all very familiar with surgery, is removal. Radiation therapy is a focused form of high energy X-rays that is given to an area that either can't be removed completely, or we know that there's risk of cells being left behind, so we add on radiation to that area to kill those residual cancer cells. Chemotherapy is either a pill or an injected drug that goes throughout the body that targets the cancer cells by killing any rapidly dividing cells. So you often have other side effects also from chemotherapy. Hormone therapy is specifically for patients who have estrogen receptors or progesterone receptors on the surface of their cancer. And these hormone therapies block the effect of estrogen on the tumor so that estrogen can't stimulate the growth of the tumor. And immunotherapy is a treatment to enhance the immune system's reaction to the cancer and ability for the immune system, the patient's own immune system, to fight the cancer and treat and kill the cancer.
I see. Okay. Something that Jose, my previous guest, said, and he was sharing about his personal experience and his wife, it was that he felt that the doctors were pushing the chemo too much. And I have heard that before from other people who have experiences with cancer. What do you think about that? Is it because it's the most effective, or it's just a perception, or is it because chemo has such a bad stigma? What do you think about that?
Well, chemotherapy definitely has a bad stigma. But in watching patients get chemotherapy over my 25, 30-year career, it's definitely gotten better in terms of how well tolerated it is. We have much better medications to relieve some of the side effects. And in breast cancer specifically, we're definitely moving from an era, if we look back 20 years, many, many people got chemotherapy. Now, today, we have more tests available to decide if chemotherapy will really help the patient, if it will benefit them in terms of survival. And so we're much more selective in which patients get chemotherapy in breast cancer because of newer tests that we have. So I would say that if a doctor is recommending chemotherapy, for the most part, that doctor really believes that chemotherapy is going to help that person in terms of survival. Because we all realize it is no fun getting chemotherapy. There's lots of side effects. It's hard on patients. It impacts a lot of areas of their life. And if it's not going to help them, it's just too much treatment to go through. But if it's going to help them, it can be the only treatment that's going to help them in the same way.
Of course. And that's why research and awareness is so important, because the more resources invested on this, the more you guys can continue finding better options to detect and treat this cancer. So you're already telling us how this has changed throughout this 20 plus years, and how now people have more options before they get to the point where chemo is the only option. Right. You mentioned something about the cancer gene a few minutes ago, and I would like to ask you about that, the cancer gene.
Uh-huh. So go ahead.
I was just going to say that I understand there are two types. One, I believe, is called, I have it here on my notes, BRCA1, and the other one is BRCA2. I wanted to ask you about the difference between them.
So there are many cancers. Truthfully, there are many genes that we know that can increase your risk of breast cancer. BRCA1 and BRCA2 that you mentioned are the two that are very strongly associated with the development of breast cancer. They're also associated with the development of other cancers like ovarian cancer, pancreas cancer, and prostate cancer. If you were to read about them before, we typically thought of them as occurring in an Ashkenazi Jewish population, but we now know that we can see these genes in many different ethnicities. So are definitely a strong population in the Latino community for being BRCA1 and BRCA2 positive. So these are tests that we will do once in very specific patients once we know they have breast cancer. So patients with a strong family history, patients who are younger than 45 who have breast cancer, and patients who have breast cancer in both breasts. All of those patients would be recommended for genetic testing. When you see the genetic counselor, they take a full family history and decide on which genes should be tested. And it's usually not just BRCA1 and BRCA2, but a full panel, a whole complement of different genes that are tested to see if not only those genes might be abnormal, but other genes might be abnormal.
I see. I wonder who should consider taking the test for this. I'm pretty sure it varies depending on the country and probably on the state's regulations here in the United States. But I mean, Angelina Jolie was someone who made this very popular when she shared that she discovered she had the gene cancer, and she decided to go through a preventive double mastectomy. So that makes me think, okay, is this something that's available to everybody? Can anybody just take the test? And is it recommended to do that or not?
So it's, while anybody could get the test, whether or not their insurance would cover it those are two different things. So the insurance, there's very clear guidelines of who the insurance will cover their gene testing. And those guidelines are, like I said, people who have a strong family history, people who have bilateral breast cancers under 45 and diagnosed with breast cancer, and there's another one. But if a patient just wanted to be tested, they could pay out of pocket for it. But I recommend that they always see a genetic counselor, because there's then the interpretation of the results and figuring out what to do with the results. So that's the thing. It's one thing to get the test, but then another thing to decide what you're going to do with that information. As you said, Angelina Jolie decided to have both breasts removed. Some people may not be ready to make that decision. So the whole question, that's why you have a counselor that you meet with to discuss, okay, if I find out that this is positive, what do I want to do? Do I want to remove both breasts? Do I not want to remove it? Am I ready to deal with this information? How's that going to impact the rest of my family? All of those things. So you really, it should be done in the setting of meeting with a genetic counselor, not just, on your own. And a sidelight is that tests like 23andMe or these things that are available kind of over the counter that don't need a doctor's order, those may not have a complete testing for these genes and may not provide the same assurance that the patient really is negative if the test comes back negative. So
I see. I'm glad that you're making that clarification, because I'm sure many people will think about that option. I wonder what's more expensive. Is that test expensive? I gotta believe it is.
So that's what you would think. But in recent years, the test has come way down. And there's a certain company that we use here, not to endorse it or anything, but that we use here at Stanford, that the out-of-pocket cost, if your insurance doesn't cover it, is actually very low. It's less than $500.
That would be the total cost.
That would be the cost of the test, not necessarily the cost of seeing the counselor and everything.
I see. Okay, of course. So that will be only for the test. Well, that gives us some idea. So now that we're into numbers, let's continue talking about numbers. So I wanted to ask you about this and share this information with you. I have it on my notes. According to the Center for Disease Control and Prevention, each year 245,000 women are diagnosed with breast cancer, and many of them are invasive in the form of an invasive cancer. So how are these numbers and trends collected? How do we know how many women are going to be diagnosed with cancer?
Yeah, so when a patient is diagnosed, her pathology, or when she has a biopsy, so she comes in, for example, let's say she has a mammogram, something is abnormal on the mammogram, she gets a biopsy, and that biopsy shows that she has cancer. That's then put into a hospital database, and from that database, that's how we get our national statistics. So from the biopsies.
I see. And let's now transition a little bit into ethnic groups. You already mentioned something about Latinas and Jewish women. Do we know how many of this number in the United States are Latina that are going to be developing breast cancer? Do we have any data specifically about Latinas?
Yes, but I don't know that number off the top of my head. But yes, definitely. Yeah, they are broken down, and so the statistics are broken down both in terms of incidence. So the 245,000 that you reference is the number of women who will be newly diagnosed with breast cancer. If you look at the number of deaths, there's also data on the number of deaths per year from breast cancer. So breast cancer is the leading cause of cancer in women, but it is not the leading cause of death from cancer in women. Lung cancer remains the leading cause of death in women.
Wow.
Cancer.
So that still gives you some hope.
At least. And it tells you you shouldn't smoke. It tells you you shouldn't smoke. That's what it tells you, because we have much better our improvement. Our survival from breast cancer has improved in the last 10 years, meaning you've seen a decrease in the death rate. Lung cancer still remains a much more difficult disease to treat than breast cancer. So yes, we have data on different ethnic groups and how they fare in terms of incidence and survival. It can be broken down by state and by ethnic group.
And I know you said that at least for the cancer gene, it has changed. But I wanted to ask you specifically: is there an ethnic group that it's more, it's like the one that develops more cancer at least now currently?
As it relates to the gene, I think it's still most common in the Ashkenazi Jewish population, but now, like as I said, I've seen it in Latinos, I've seen it in Asians, I've seen it in just about everybody.
And how about the breast cancer in general?
That cause breast cancer, yes. So in this.
So is there one specific ethnic group that is more vulnerable or not?
No, I would say no. There's not one that's more vulnerable to the development of it. If you look at the statistics in this country, though, African-American women still die at a somewhat higher rate than non-African-American women.
And did you have any information about that? Why is that?
It's not clear. It is in part a biologic. It's just that the nature of the disease is different. Are some differences in stage of presentation and things like that, but it is in part just the nature of the disease.
I see. So it's not necessarily related to their access to healthcare. It's more something in their genes, in their genetics.
Right, right.
I see. Okay, got it. Well, I think we have covered a lot of information, but before we end, I would like to give you an opportunity to add any information you feel is important for us to keep in mind, maybe a question that I didn't ask that is important, and just some final recommendations from your perspective as a doctor and as a woman.
Yeah, well, I will echo what Jose said, that it's women definitely should seek care if they find any changes in their breast. If they, find a lump that's worrisome to them, they should definitely seek care. And especially, as you mentioned, young women who find a lump and someone tells them, "Oh, there's no way you can have breast cancer," they really should get fully evaluated, because we have seen breast cancer in young women, and it is important that they be thoroughly evaluated. In terms of prevention, I think it is important for all women's health to exercise regularly and eat a balanced diet and not gain a lot of weight as you age. I think that we hear it all the time that we should exercise more, but it's a really important thing for our bodies to stay healthy, to exercise regularly. And I can't impress that upon my patients enough. And it really helps them when they're going through treatment for them to exercise regularly. It is one of the things that is very available for patients to do. It doesn't need to mean going to the gym or anything. It's just walking regularly. These things are very helpful for patients for their overall health. It helps everything. It helps blood pressure. It helps heart disease. It helps cancer. It helps everything to stay regularly exercising.
Okay, these were supposed to be your closing remarks, but I have one more question.
Okay.
Based on what you just said, and I totally agree with you that exercise is extremely important and very helpful in many areas in our life. I just thought that it would be helpful if you could explain a little bit how exercise helps specifically against cancer or breast cancer.
So that part is a little bit tricky. It's in part the weight, but it's the exercise itself too that probably adds something. The other thing is sleep is also an important thing that we don't fully understand yet how it relates to cancer, but we know that getting enough sleep is a very important thing for your overall health and for cancer and breast cancer specifically.
I see. Well, the healthier you are, the better in any scenario. So that's always an easy thing to understand.
Yeah.
Thank you so much, Dr. Carol, for your time, for breaking everything down in an easy way for us to understand all of the very important information, and for making time to share some information about this with us today. I'll let you go now, and thank you everybody else for watching and joining us today. See you next week. Bye-bye.
Okay, thanks. Bye-bye.